Recently, I've noticed that parents have been coming to me quite sad with questions about their child or teenager possibly being depressed. Well, first, it's important to know that a sad child doesn't necessarily mean a depressed child. Depression is a biologically based illness that can run in families and can be triggered by significant life events, stress at school, having a chronic illness, or even being victimized or bullied. It affects more than just a person's mood and lasts not for hours or days, but for weeks, months, or even longer. What makes depression even more difficult to diagnose is that sadness is not necessarily how you'll know it's there. A child or teen with depression may be irritable, angry, have a fall off in school performance, have no appetite, no energy to do things they previously liked to do, or even over or undersleep. While these signs may point to other disorders, depression should always be considered, or these children will go on to feel rejected and unloved. And if unrecognized and untreated, depression may even prompt kids to demonstrate increased risk-taking behaviors like use of drugs or alcohol and consider harming themselves or even attempting suicide. If you're concerned that your child or teen may be depressed, please talk about the situation with your child's healthcare professional, who will be checking for depression at annual health maintenance visits, particularly in adolescence. He or she will want to meet with your child or teenager, and if depression is diagnosed, will likely recommend counseling and possibly the use of a medication that can help treat this disorder quite successfully in children and teens. Of course, the best way to deal with depression is to not let it occur. Be sure to have open, ongoing daily discussions with your child that are established long before signs of depression can develop, so your child doesn't hide their feelings from you. The more you can listen to their thoughts on how they feel and offer your support and love to them, the more apt they are to accept that support and move forward to get the formal treatment that's needed if they are depressed. Most of all, parents, you need to be patient, understanding, and not frustrated when your depressed child or teen acts out with irritability, anger, and sadness. Remember, these are manifestations of the disease and not signs of intentional disrespect. Hopefully, tips like these will elevate your knowledge base and in turn, you and your child's mood when it comes to recognizing depression and pointing your child or teen in the right direction to get the help needed to overcome this mental health problem. This is pediatrician Dr. Louis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.